I am super fired up for the prospect of what we can do for patients with regenerative medicine options. Okay, now let me lay the foundation for you. Okay, I'm going to give you a very sobering statistic. I want you to take this in. In the U.S. alone, more than 25 million people suffer from chronic daily pain. You may be one of them. You may have family members that are one of them. That means every single day you're hurting. Lots of it is related to orthopedic conditions like osteoarthritis, okay, of any joints, knees being a big one, hips, shoulders, etc., and then spine conditions, which are way up there and causing pain. Now, we've got really, reasonable conventional treatments, okay, like steroid injections, pain medications, anti-inflammatory medications, and then surgical interventions if necessary. As a spine surgeon, I can tell you many people would benefit more from regenerative medicine options than there are from spine surgery. And we know that. And typically, many times if you see an orthopedic surgeon or if you see a spine surgeon, if they, feel that you're just not ready yet for surgical intervention, they're going to send you off for other conventional treatments, again, steroids and medications and physical therapy and things like that. And I think it's been the mainstay of care. But regenerative medicine options, okay, which a lot of people, now that I'm on this tour, I just finished this TED Talk, so many people are unaware of what's possible with regenerative medicine and what those options really are. So I want to talk about it for a second. So I put regenerative medicine into really three buckets. What are we doing in regenerative medicine? You're basically trying to regenerate tissues. Okay, you're trying to decrease inflammation, get those cells, doing the right things as opposed to creating a lot of pain, destruction, and damage, those kinds of things. And so as opposed to steroid injections, which can damage cartilage, as opposed to surgery, which obviously is invasive, or, even like if a meniscectomy, in other words, taking out a piece of the meniscus in a knee, there are other ways to do it where we're trying to rebuild the tissues, okay, rebuild that scaffolding, get the body working for you, okay, instead of invading the body. And so my three buckets are as follows. One is the biohacking bucket. That's kind of the lower level bucket. We're talking about light therapies, photobiomodulation. The big one in orthopedics and spine is class 4 laser therapy. It's a laser that can penetrate deeply. It's non-invasive. It can really stimulate healing, reduction of inflammation. It is great to reduce and diminish pain. Now, it can work well in many people. A lot of times, though, it may not be, the long-term, fix for things because, these things will wear off over time, although there's benefit that can be, longer lasting. The second bucket is peptide therapy. Now, I've talked about peptides. They're these short chain. They're amino acids tagged together, typically between 2 and 50 amino acids. There are regenerative peptide stacks that you can give to patients to really diminish their inflammation and try to stimulate rebuilding and repair with BPC 157, one of my favorites, something I recently talked about on a post. Now, the final category and the big one, the one that there is so much excitement and buzz over, I just gave a TED Talk recently about the applications in spine care, is using stem cell therapies to really make a significant impact. And so the question is, can we be preservers of joints, preservers of the spine, instead of thinking about it in more conventional terms? And stem cells gives us an opportunity to do that. So just high level, how does it work? We are taking your own stem cells. They're called mesenchymal stem cells. Okay, the Dr. Kaplan, who named them mesenchymal stem cells, wanted to name them medicinal signaling cells because when they're put into the body, they signal the tissues around them to heal and to repair. And so they're taken out of your own body, either from the bone marrow or from the fatty tissue, and then reintroduced with precision guidance injections to the exact area of pain and inflammation. And then they set up their command centers, they go to work, and they're there for a long, long time, stimulating repair and regeneration. It's really exciting to see the data that's coming out, like, for example, on knee arthritis, where some patients are having tremendous relief and pushing out or avoiding surgery altogether. It's a very exciting field. As a spine surgeon, I am seeing really great benefits in patients that I am sending off for regenerative medicine procedures, such as autologous stem cell injections. That's your own stem cells. There's a lot of misinformation around stem cells, like they're all embryonic or related to cloning, but autologous stem cells are something that is available today and is showing tremendous impacts. And so these buckets of regenerative medicine are giving us amazing options to heal and to make people feel better. It's a great option to try to avoid surgery. Now, listen, some people absolutely need surgery, but many don't. So can we avoid surgery, and can we push it off for a long period of time? Now, again, this isn't medical advice. You need to talk to your own providers about what the options are out there. Hopefully this helps. If you have any questions, I urge you to leave your questions in the comments section. I will get to them. I love talking about this particular topic, but more importantly, talking about how to get people out of pain, because it's such a huge problem today. So let's work together. Let's get you, your families feeling better. We will see you on the next video.